here. So this is going to be Dr. Laura Haug. She is going to do the canine behavior, birth to adolescence. I'm going to give you the stage.
Thanks. All right, well, thank you. It's been a long time, admittedly, since I've been to a Doberman meeting, because years ago when my Doberman died, cardiomyopathy, unfortunately, and then I went looking for another puppy, and then somebody brought me this little pit bull mix as a behavior case that was in foster, and then I got sucked in and I adopted her, and so that's where I've been. But I'm a board-certified veterinary behaviorist, and so we're going to talk today about some of the developmental stages. Let's see if this is going to work. It did a minute ago. All right. So we're going to talk today a little bit about influences of the perinatal environment on puppies and their brain developments. We're going to go through very briefly the developmental stages that have been studied in dogs, but we're going to focus primarily on the socialization period and on adolescence, and what little we don't know, or little we know about adolescence, especially in dogs. So the developmental stages that are pretty well defined in dogs are basically birth through what we call the juvenile period. So that's up to sexual maturity. So in dogs, that's about 6 to 7 months of age. So any of you that have looked at some of the Pfaffenberger stuff, like the guide dog programs have done historically a lot of work on puppy development, and then the classic Scott and Fuller studies where they took the different breeds of dogs, they bred them to each other, studied the puppies up, but none of those studies really go past 6 months of age. So we've got these really well-defined, prenatal periods are neonatal, what we call birth to 2 weeks, transitional, which is about 2 to 3 weeks, because they're transitioning basically from being helpless to being able to start interacting with their environment a little bit more because their eyes and ears open, and they also start to get more mobile and don't rely entirely on just sort of swimming in the litter pen to move around. And then the juvenile period, 12 weeks, so kind of the end of our sensitive socialization period up to sexual maturity. And the reason I put adolescence with a question mark is because we certainly know adolescence is really well defined in people. So we're going to talk about a lot of the human literature today when we talk about adolescence, but nobody has specifically studied adolescence in any of our domestic species. So we don't have data on dogs, cats, horses. What we do have are similarities in brain development that we know occur across species. And clinically, we see changes in behavior, both normal behavior and pathologic behavior, that suggest to us that there are some similar patterns of adolescent development in our dogs versus people and rodents that have been well studied. So as I said, the two things we're going to focus on the most today are going to be the socialization period and then our adolescent phase. But I do want to talk about some perinatal influences. This is kind of a particular interest of mine. Sometimes we see cases or we get on topics and then you kind of go down a research rabbit hole. And because, many of you here are breeders, what happens in the perinatal environment is really pretty crucial to what happens to those dogs when they grow up to be adults. Years and years ago, people that had psychopathy, like schizophrenia and stuff, was blamed on refrigerator mothers. Like it was always the mother's fault because she was like cold or not loving enough. And then the psychiatric world kind of moved away from that, partly because we knew there were neurobiologic and there were hereditary factors that impact whether you're likely to develop schizophrenic type disorders or not. So then we were like, well, it isn't the mother's fault. But now when we look at some of the other research that we have looking at perinatal influences and epigenetic influences, so we'll talk about those a little bit more, but epigenetic influences are changes that don't occur to your actual DNA, but they are changes to which genes in your chromosomes get turned on and activated versus which ones may be turned off or deactivated. What's kind of scary about epigenetic changes is that they can cross generation. So something that happens to a mother when she's pregnant that impacts the development of her fetus's brains, those kids or puppies or rats or whatever, when they grow up and have offspring, they pass those same changes, some of them, onto their offspring. So we don't even have to change the actual DNA to screw up our grandkids. We just have to change which ones of those genes are turned on and off and how they impact with the environment. So that's why your maternal health, the mental and physical health, is so critical. Like we know it is in people. Like we don't want our pregnant women drinking and smoking, and if they have injuries or accidents, all of that impacts the development of the fetus's brain. And that's true in our animals. It's true in every animal species that's been studied so far, including dogs. What happens to the mom happens to the puppies in utero, and it also impacts the puppies for a certain degree after they're born. Because puppies don't achieve adult-like EEG changes in their brain until they're about 8 weeks of age. So that's when we start getting kind of stable learning patterns. That doesn't mean puppies can't learn before that, because they can. They can start learning in utero, actually. But they have a more adult-like pattern by the time they're 8 weeks. But what that tells us is for that first 8 weeks, that brain is rapidly changing, and it is still impacted by influences from the mother, both nutritionally, but in how she interacts with those puppies, okay? So we're going to talk a little bit about maternal diet too, because your previous lecture mentioned probiotics, and we're going to talk a little bit about the gut microbiome, because it's like a big thing right now, but it's also a huge thing in behavior. So we're going to touch on that a little bit, but the reason I bring up maternal diet is because maternal diet has a large impact on the health of the dam's gut microbiome. And puppies' gut microbiomes are initially colonized primarily during birth. So whatever the GI tract health is of your mother, that's basically what you're going to pass to the puppies. And if it isn't particularly healthy, when we talk more about the gut microbiome and how it impacts your brain development and your stress response system, we know that derangements in that GI tract health can have a major impact, again, on how those puppies develop and how they behave as adults, and what kind of health issues they may be at greater risk for developing too. So we know, this is, by the way, if you want to read a little bit more about stuff in dogs, this is a really nice little review article, a paper that is open access, so you don't need a subscription to get it. You can go online and like do a Google search or something. It actually covers some of these topics, like we have some data about environmental pollutants and how it impacts our development in our brain, like bisphenol A, everybody was freaked out about in plastic water bottles for so long, especially if you leave them sitting in your car and then you drink out of them, like not good for your body. And it'll also go over things like maternal separation. Maternal separation stress is a major stressor on puppies and other neonates. How many of you in here are familiar with Carmen Battaglia's work and the biosensor program and stuff like that, okay? So those programs are, there's some data behind that. The big question has always been how much stress is too much and how much stress is too little to get the perfect puppy. And if we had that data, there would be a 0% failure rate in the military working dog program, at least for behavior and performance, okay? Because we'd build the perfect mental puppy. But nobody's been able to do that. So when we talk about stressors, the reason I bring up maternal separation is because maternal separation, even for short periods, like 15 minutes, can have a massive detrimental stress effect on puppies and offspring. Not just puppies, but other offspring too. Early weaning, we know, is a massive stressor. The way animals are weaned can be a massive stressor because weaning's stressful anyway. I mean, even think about trying to kick your kid out of the house sometimes. But nutritional weaning, but particularly psychological weaning, is very difficult and stressful because it's a very traumatic time in a natal unit and separating offspring from the safety of and protection of their parents. The other thing we know from a lot of studies in research animals, but also some in dogs and cats, is that the amount and type of mothering and grooming that the mother does to the neonates impacts their stress response system as well. So it impacts the part of your brain, which what we call the HPA axis, the hypothalamic pituitary adrenal axis. This is your stress axis. It's your fight-flight system. And the amount of grooming that happens to puppies or neonates actually impacts whether that HP axis helps protect you against stress or makes you more susceptible to stress. So here's that gut microbiome. There are microbiomes in all places, like you have a skin microbiome, you have an ear microbiome, you have a nose microbiome, and you have the gut microbiome. And your gut microbiome is the biggest one. It's a huge organ system. It is called the second brain of the body because there are actually neuronal cells in there, but also because things that happen in your GI tract impact your brain. So there's this bidirectional communication. So there's a little GI tract down here. These are the cells that line your intestinal tract. This is the inside of your intestinal tract where all your ingesta and all the viruses and bacteria and fungi and stuff reside. And then you have nerves, your big vagus nerve, which is the big giant nerve that kind of helps control your heart. So there's 3 paths of communication between your brain and your gut. One are nerve pathways, like your vagus nerve. One are immune responses, so immune-related chemicals, basically. So there are chemicals that your GI tract produces. The bacteria actually produce them. They get absorbed, they transmit up into your brain, and then they impact your behavior. All right. So these 3 and then there are hormones and neurotransmitters. So like your GI tract produces serotonin. There's actually more serotonin in your intestinal tract than there is inside your brain because their platelets have serotonin. So there's a massive serotonin load in your GI tract, which is why sometimes when you take certain drugs and then you get diarrhea. But these are always communicating with each other. So what happens in your brain impacts your GI tract health, but what happens in your GI tract impacts your brain. And in the literature nowadays, there are ties between gut health and a lot of different psychiatric situations. There is a very, very strong, unequivocal link between GI health and depression and anxiety in every species studied. You can take normal mice, give them an infection, mess up their GI tract, and they will show anxious behavior. You can take sick mice and make them healthier, basically treat the infection, or you can take an anxious mouse, transplant that mouse's gut microbiota into a healthy mouse, and you will make the healthy, normal mouse act anxious, and vice versa. Unequivocal link between those. Most veterinary behaviorists are actually also gastroenterologists. So we've been seeing this link long before the gut microbiome became kind of a big thing. We were like, why do all these dogs with behavior problems have like chronic gastrointestinal disease? Especially the golden doodles. Like almost all the golden doodles have chronic gastrointestinal disease. It's a huge link. So we will have trouble getting behavior disorders under control if they have untreated GI disease and vice versa. Because obviously this is a circle. You know, all of you know if your dogs get stressed out sometimes or they go on boarding or whatever, they can get stress diarrhea. So stress can screw up your GI tract, but then your messed up GI tract helps to keep screwing up your behavior. Like, it's a big vicious circle. So as I mentioned, your gut microbiome is colonized primarily at birth. So that means it's greatly impacted by the health of the mother. Other things, the location where you live in the country, the individuals that you live with, like there is overlap in the gut microbiome diversity between dogs and the people that they live with. So when dogs and certain people live together, that family, they have more similarity in their gut microbiome than a dog and its microbiome and somebody that lives in a different house. So diet is a major factor, but your location, what you're exposed to, the environment. You know, we've known for years that kids that live on farms, that are around manure, that go out and play in the dirt, are actually less likely to develop allergic disease than kids that are in these hyper-hygienic environments. And that is because they are colonizing their gut microbiome, and it is improving their immune health so that they have better protection about some of the onslaught that is happening in our world. So your age, gender, those that you live with, there's a lot of different things like that that impact your microbiome, but the two big things, birth and diet, and then your health. So as I mentioned before, this stress response axis, your gut microbiome impacts how that develops when you're a baby. So puppies that have a deranged gut microbiome, like they're sick, get parvo, early weaned, whatever, we expect those puppies to have a higher incidence of health issues and a higher incidence or a higher risk of developing behavior problems. And in the beginning, when we found this link, like early weaned puppies or puppies that get sick when they're young, like they're 4, 5, 6, 8 weeks of age, we knew they were more likely to get health and behavior problems, but we didn't necessarily know why. Well, now we know a major reason why, which is the impact this has had on their gut health and how their gut health has impacted their brain development. Your gut microbiome controls or contributes to the health of your intestinal tract. So like how many of you have heard of like leaky gut syndrome? So your intestinal tract keeps the stuff inside your intestines that you shouldn't absorb from getting into your body, and it just wants to absorb the good stuff. Well, when your intestinal barrier starts to break down, then bad stuff gets into your systemic circulation and good stuff in your body actually leaks out. But your gut microbiome is one of the major things that protects the integrity of that barrier, but it also impacts the development and health of your blood-brain barrier. So the barrier that keeps the icky stuff in your body from getting up into your brain, the stuff we don't want getting up there. So when your GI tract's deranged, that blood-brain barrier breaks down, and then stuff that shouldn't get into your brain does get into your brain, like those inflammatory molecules when you have an infection that get up in your brain and then make you act cuckoo or depressed or anxious. Or those of you that have ever had an elderly parent that got a bladder infection and literally went cuckoo, like they get psychotic and they sometimes hallucinate. This is partly why that happens. Those inflammatory chemicals manage to get into the brain when they shouldn't be able to. All right, so these can have a permanent impact on your stress response system development. You screw up the GI microbiome when they're little, you can permanently screw up your puppy's brain, and then they may pass that on to their puppies. So they become hyper-responsive to stress and have an increased risk of being anxious. We don't diagnose depression in dogs technically, although I think dogs do get a canine version of depression. It just tends to sometimes manifest a little differently than what we see in people. All right, so whatever puppy you have now, we move on to socialization. This is my definition of social, isn't the definition is, but socialization is probably inarguably one of the top 2 or 3 things that help determine whether a dog's going to grow up to be well-adjusted, resilient, and adaptable. So genetics is a big one. So that perinatal environment, genetics and neurodevelopmental influences, so that epigenetic stuff, socialization, and training. Not only the amount of training, but the type of training. Oops, I'm going to go back up here. So this is a 12-week-old Labrador puppy. What would you expect a 10 to 12-week-old Labrador puppy to look like when it meets people? It should be social, maybe a little wary because it's 12 weeks old and neophobia starts to increase at 12 weeks of age, so they start getting more wary about new stuff. That's a protective mechanism. But if the puppy's had any reasonable socialization and has good genetics, that puppy should get into an environment and go, well, this place could be a little scary, but boy, there are people, and that puppy should be running up and being like, you know, this is awesome, you're wonderful, I love people. So this is not a normal Labrador puppy. This is a little puppy that he's also 12 weeks old. He came out of a shelter. And he is, as you can see, apprehensive. Oh, I just realized we're not going to have audio, are we? So he's circling around behind, he's apprehensive, he doesn't want that, you know, front-to-front greeting because that's when you could get killed, and then he's going to do some displacement sniffing. They're both doing it. This is a kind of a, some people call them calming signals, but, you know, the Doberman's not scared of the puppy, but because she recognizes the puppy's apprehension, she is also just be like, hey, we're just going to sniff the ground. This dog is very good at cutoff signals and throwing out behaviors to reduce tension and avoid escalation of fear or aggressiveness. Yeah, I was hoping it would come through. It's probably not going to pick up on his audio. Do we have an IT person that can hook an audio system up? So this puppy's just been poorly socialized to dogs, but he is showing some curiosity. Like, this is mostly a socialization deficit from this puppy and probably not a pathology that was there from birth. Some puppies just come out messed up, you know. That doesn't mean we can't help them, but it's always nice to start with one that's relatively normal. So socialization and obligation, and we're going to go into this in more detail, but as I mentioned before in puppies, the peak sensitivity to socialization in dogs is 3 to 12 weeks. Although socialization starts to certain sensory perceptions in utero. Like puppies can be socialized to gustatory, so taste, in utero. What you feed the mother impacts what the puppies will accept. Many times, this is particularly true, especially in cats too, like the mother catches rabbits. When the kittens start eating, they are oriented towards rabbit-type things. There are probably some olfactory socialization happening in utero as well, and probably a little bit of tactile. But of course, most of your socialization is going to start after birth. So why do we need it? Well, we need to ensure that these animals, you know, dogs are dogs, aggression's normal in many situations, biting's a normal form of communication, as is growling. That doesn't mean we like it. They have to learn to live in our world, in our rule structure, and then it's our job to help them do that the best they can. We can't expect them to just know how to grow up to be a good dog in an ever-changing society, you know. I've been training dogs since 1980, and even in the time, I see the different role now that dogs play versus what they did even 20 years ago, you know, and we are putting them in a more artificial situation. And how many of pet owners that you know, pet owners, have a dog that's actually doing a working function? Anybody in here know a neighbor or friend that has a dog doing a working function? Not one of you. So it's very few people that go out and buy a Doberman or a Dalmatian or even a Yorkshire Terrier. You know, it's small. It must just be an ornament then. And then I'm like, do you know what these dogs did? No. They're like cute, right? They kill rats, you know, and I mean, dachshunds. I mean, they go into holes after badger. I mean, come on, how tough do you have to be to do that? So if we're going to stick them as a square peg and try to shove them in a round hole, it's kind of our job to do what we need to do to help them be the best they can be, basically. And this also improves the pet's welfare. I don't know how many of you have had a dog or even a cat or something, or a horse with a behavior problem, particularly a really significant fear or anxiety disorder. I mean, like these dogs that come in that basically have agoraphobia. Like they are terrified to even step into their own backyard. They are terrified. They're terrified of people. They're terrified of other animals. They won't go out in their backyard. Trying to get them to the vet is a nightmare because they're just in a total panic. That's not an inconvenience to the owner. I mean, it is, but it's a horrible welfare situation for the pet. And even dogs that have less dire behavior responses, like storm-phobic dogs. How many of you in here have a storm or noise-phobic dog? Okay, so if you've ever had a panic attack, a true panic attack or an anxiety attack, then you have an inkling of what your storm or noise-phobic dog feels like. It's not just an inconvenience to us. It's a serious welfare issue for the animal as well. So that's the other reason that we kind of have this obligation about socialization. So this is the worst advice my veterinary profession ever gave to breeders and owners. It's still, people are still being told this. Worst piece of advice ever given to people is wait until all their vaccines are gone to take them out and socialize them. Take them out, but don't let their feet touch the ground until they're 12 or 14 or 16 weeks old. You are screwed if you do that, like you are, all right? So socialization it's not something that we can delay because there's this sensitive period where their puppy's brain is a sponge. And we're going to go through some of the changes. Like at this phase, they're open and receptive. Like 5-week-old puppies, normal 5-week-old puppies, you can hurt them and they will go, ah, and then they will come right back to you, all right? If you hurt an 8-week-old puppy, they will not come back to you because the difference in their brain development, they are now going through a phase where that fear learning has a greater, more permanent impact. So one terrible experience at 5 weeks, and the puppy may recover from it. One terrible experience at 8 weeks, and they may never recover from it because of the difference in the brain development, the stage of the brain development, okay? So we're going to go through some more of those, but this is a time-sensitive issue. It's not something that you can put off. So we know socialization can be done safely to balance health and behavior. I was in general practice for years, and I actually did emergency medicine for quite a number of years, full and part-time. So I saw plenty of parvo puppies in my day. And the thing about parvo, it's horrible, and it probably is going to impact them, again, behaviorally long-term, but 75% of parvo dogs that get treated are going to survive. But if you take 5,000 puppies and then you wait to start socializing them until they're 12, 14, 16 weeks, 18 weeks, maybe 6 months when they go into their first, obedience class, I guarantee you there's going to be a greater percentage of those dogs that are going to either end up in a shelter, in a rescue, back in your home, or in a freezer because they're going to get euthanized. So the attrition rate from the long-lasting issue with the behavior is likely higher than the risk that they're going to get a disease that's going to actually kill them, okay? Especially with our modern vaccination. And if you have good maternal antibodies, there are ways to do this and make it happen safely. So this is one of the first studies that's come out that's looked particularly at this, where they took puppies in puppy classes under 16 weeks of age and basically compared them to puppies that didn't go to puppy class and found that the ones that went to puppy class were no more likely to contract parvovirus than puppies that didn't go to puppy class. Do we want people taking puppies to the dog park? No. But that doesn't mean you can't take them to friends' places, places that have good hygiene, dogs that are known. They don't have to meet 100 dogs. Even 10 or 20 is fine to get them started, as long as they aren't all Dobermans, because then he's only going to like Dobermans. But there are ways to do this safely. So you get the best of both worlds. So as I mentioned, they have kind of adult learning process by 8 weeks of age, but they start getting adult levels of what we call operant and Pavlovian conditioning is present by 5 weeks of age. So what this is telling us is that our puppies are learning at 5 weeks of age, and as I mentioned, they're actually learning some things prior to that. So we don't need to put off learning. This is a 5-week-old puppy that's going to be a search and rescue puppy someday. And this puppy's got, I didn't show you the whole video, but this puppy's already got a bigger repertoire of behaviors than some adult dogs do, And this puppy is 9 weeks of age, and she knows already about 30 more behaviors than the average adult dog already knows, and she's 9 weeks of age. So the early training, in addition to the socialization effects, actually helps these puppies be more flexible and adaptable. Problem-solving skills, all right? So this is my definition of socialization. It's a graduated exposure to a variety of novel stimuli in a controlled manner to effect a positive response, and the goal is to increase social skills and behavioral adaptability. Socialization is behavioral vaccination. That's exactly what it is. We are vaccinating dogs against future behavioral disease or trauma. Because if a puppy meets a horse or a chicken or tall people and short people, and those are all positive experiences during that sponge phase, then down the road, that puppy's going to see a green person and be like, oh, I've seen about 16 other color of people, so what's another one? Okay. Whereas if they've seen Dobermans, and then at 6 months of age, they see and hear their first bulldog, the dog's probably going to freak out and then bark and growl. And then, of course, the bulldog, especially if it's a male bulldog, is going to go, and then they're going to go at it. And then we've got this learning process happening that's just going to start snowballing, you know? So, but if the puppy sees a bulldog when it's 6 or 7 weeks of age and has a good experience, then when it sees a bulldog later at 5 or 6 or 8 months of age, it's probably going to go, oh, I met one of them before. That wasn't so bad. So they don't do this anymore, but back when I grew up, dog dips were like the big thing. Like before we had all this good oral and topical flea control, you know, some of you remember this, I'm sure. Like these places would, you know, they'd get these big vats of paramite and stuff or permethrin, and then people would come line up with their dogs like they do now for vaccines at Tractor Supply, and they'd walk by and all these big able-bodied young men would pick the dog up, dunk the dog in this foul-smelling dip, you know, wipe them all down, pick them up, send them over to my station where I was clipping their toenails, and, you know, this is what they did. So how do you think an unsocialized dog is going to handle this? I mean, a well-socialized dog, honestly, would have trouble handling this, but a well-socialized dog just might go, whoa, that one experience wasn't great, but okay, I'll move on. But if this is the dog's first, or one of its only first 3 or 5 ventures out into the world, and this happens, then this has a lasting effect. If you've met 100 dogs, and one of those dogs attacks you, you're going to go, that dog is mean. But if you've met 1 dog or 2 dogs or 5 dogs, and one of those dogs attacks you, if you've only met 1 nice dog and 1 mean dog, now what are you going to do? You're going to be like, that dog's nice, but the rest of the dogs are mean. And that's how we end up with dog-reactive dogs. One way we end up with dog-reactive dogs. So, sensitive period, smell, smell, taste, happens before birth and definitely at birth, all right? They find their mother's stomach with odor and heat, so they smell the milk, they know how to get to the teats, all right? Tactile, as I said, definitely at birth, maybe even prenatal a little bit. So this means we can start doing this kind of socialization. That's why even really early on, you know, within 2 or 3 days with that biosensor stuff, they're having you stroke their paws with the little cotton swabs, and we're doing things like heat or cold because they can have tactile socialization even before their eyes and ears open up. Once their eyes and their ears start to open up, then we have to be starting auditory and visual socialization. And we're going to go into some more specifics about this, but it has to be broad. If you take a puppy or a kitten and it grows up basically in its developmental period, like from the time its eyes open to 10 weeks or whatever, in a room that only has vertical stripes, it will not be able to see horizontal stripes. So 3 to 12 weeks, sometimes we think maybe we can stretch this out to 14 or 16, but realistically, maybe not. I mentioned before, the peak time for puppies to approach people is between 3 and 5 weeks of age. This means you have to have people coming to see your litters when they are between 3 and 5 weeks of age, because we want puppies to be meeting people at the stage when the puppies are developmentally drawn to people, okay? And because if somebody does something stupid at 5 weeks of age and the puppy goes, ah! Then he's going to go, okay, I forgive you. Whereas if somebody does something to a puppy like that at 8 weeks of age, you might not recover from that. So puppies are hypersensitive to physiologic stress and psychological stimuli around 8 weeks of age. Hypersensitive. Not just sensitive, but above normal. That's why I mentioned a single bad experience at that age can have lasting effects. This is why the Bar Harbor, the Scott and Fuller studies said the best time to adopt a puppy was at 7 weeks of age, so that you didn't get into this. And I'm not going to make this into a discussion about whether we should or should not be cropping ears. I'm just putting this up here because, you know, when you're talking about things like docking or cropping, people are going to bring up 3 questions. The first one is, should you do it? This is not this discussion. And then, but if you do it, then we need to be asking when and how. So maybe 8 weeks of age isn't the best time to do ear crops because of the stage of their brain development and the impact it could have on them long term, like forever. Before or after. The problem is, you know, if you go too late, then you're getting into, you know, different challenges. So I know some breeders that were doing them at 7. I'm just saying this data suggests that 8 is not the best time to do it. So we either maybe need to be looking earlier or pushing it out. I don't know, how late are you comfortable doing it? Do what?
You can't do it after 11 weeks.
You can go to 12 usually, type thing.
Yeah, so.
So how long does the hypersensitive period last?
It's a gray zone, and it's going to vary with puppies too, because we even know that, you know, years ago we had just like no research on dogs. Now there are studies just popping up all over the place. So now there's even, of course, studies to suggest that the developmental rate could be different across breeds. So maybe 7 weeks is the perfect age for a boxer, but maybe it's 10 weeks for a Doberman. That we don't know. But
Adoption study. I mean, we talked about not having puppies leave for socialization until 8 to 12, but then you were just quoting a puppy adoption study that said 7. So that's what I was trying to put together.
yeah, so keep in mind that was, you know, those were research animals. They were not put out into homes, you know, and things. And we know more now because those studies were done like in the 50s or something like that. But it is around 8 weeks of age for maybe a week or 10 days. So it might start at 7.5 and go up to 9.5, you know. So there isn't a hard and fast, we've got 7 days between 8 and 9 weeks, you know. It's just around that particular age is a sensitive period. So, and I'm going to come back to your other question. She made a really good point, because this is our conundrum. We really shouldn't, because of psychological weaning, we really shouldn't be kicking puppies out at, definitely not at 5 or 6 weeks of age. 7 weeks is probably sketchy. And then maybe 8, 10, or 12 is better from a psychological perspective in terms of them getting lessons from their mother and their litter mates. But if you wait to rehome them until 10 or 12 weeks, and the breeder has not done a good socialization job, then you've screwed the new owner, because they get a week or nothing of socialization. You know, if you get a 12-week-old puppy, well, you know, socialization window is now closing. Now we're just playing catch up. So that's why for actual like breeders that come sit in lectures like this basically all falls on you. I know, you know, we do the best we can with the information that we have.
Yeah, that's book stuff, you know. Breeder is a different story.
It's not book stuff. This is taken out of actual studies. I mean, we provide information, data, what we know, and then just like our clients, we don't have control over what they decide to do or not do with it afterwards. All right? So, fear of novel stimuli, new things, including people, starts to increase after 12 weeks of age. And then it escalates around 6 to 9 months of age, which is what some people call the second fear period. And then clinically and anecdotally, we think it does again maybe around 14 to 18 months of age. And when we talk about adolescent brain development, we're going to talk about why this probably happens. Because there are human correlates for this and rodent studies. So again, if you keep the puppies till 12 weeks, which in some ways is better for them, your socialization process as a breeder has to be solid. Otherwise, the puppies need to get out in the right home with somebody that knows how to do good socialization. So that's why I said the breeder has the most significant impact on successful or unsuccessful socialization of puppies. So what do? We do as many different classes of novel stimuli as we can. So these are objects, again, all 6 senses, or 5 senses, objects, environments, sight, smells, tactile things that the puppy might encounter as an adult, especially if you know. You're like, okay, one day I'm going to have kids. Well, don't wait until you're pregnant to decide if you need to socialize your dog to kids. Like, that happens, we see those clinical cases all the time. Or, I'm going to get a horse someday. Great. Let your puppy see horses when it's 7 weeks of age, and don't wait until it's 3, the first time it sees a horse, and then it freaks out and is either scared or takes off chasing it, and now you have a significant predatory response that's going to be super hard to get under control. So I'm going to say this several different times because it's super important. Socialization is not something you do to puppies. Socialization is breeders and owners setting up a situation or environment to allow the puppy to engage or not engage in an experience or a certain stimulus, a person, dog, whatever, all right? So people think socialization is something that we do. I take my puppy and I traipse it around PetSmart and I take it and I let everybody on the street meet it, or I went to this party, or years ago I did go to this Easter party with some friends. It was this big ranch and there was like a zillion people there, and there was a little girl who was probably 4 or 5 years old with an Easter basket on her arm, and inside was about probably a 7-week-old dachshund puppy on her arm. Literally, she was running around skipping with this basket swinging on her arm, and the puppy was just like,
That or bulletproof.
no, he was not bulletproof. And I just remember looking at that puppy, and I literally, it unfortunately came out of my mouth. Luckily, she didn't know what I was talking about. And I was like, well, he is now scarred for life. It would have been better for that puppy to get no socialization than to have that experience. Because it was just like, it was a nuclear explosion of stimuli that he had no control over. And that's the big factor. The puppy has to control it. The puppy has to control it. The puppy has to have the choice to do it or not. So this is not socialization. That is forced contact. It might work depending on the puppy. So this might actually help some puppies, and other puppies, it's going to ruin them with regard to children. Half the behavior problems that we deal with in dogs is what I call #DoggyMeToo. Because people are touching, handling, forcing themselves on dogs in ways, at times, that the dog does not want, does not handle, and defensive aggression is a normal communication mechanism, okay? So, all sensory modalities, start them out. So, feed them different foods when they're pregnant, different textures, you want novel scents. We do this even just as enrichment. We're like, oh, we're gonna go put stuff out. Every time I go to the grocery store, I mean, I have a puppy now, but every time I go to the grocery store, I put all my bags on the ground because I want my dog to be able to go and just be like, oh, wow, look where you went. You know, they smell the Amazon boxes. Every dog that comes into my office spends, that's able to get near me anyway, spends at least 30 seconds sniffing my watch band. And that's because it goes out to the barn multiple times every week. And it's around horses and odors and goats and stuff. So they're like, what is that animal? So bring those home and get variety. There's a lot of stuff in your house you can already do to expose young, non-ambulatory puppies to scents and tastes, okay? And then visual things. We need animals of different types and breeds, appliances, husbandry equipment like stethoscopes and needles and otoscopes. Decorations, like Halloween and Christmas is like just a terror for many dogs that go walking around the neighborhoods because they always do big blow-up decorations and the dogs like wig out. People, and then as I mentioned, different visual patterns, vertical, horizontal, circles, like whatever, because if the environment is limited, it impacts how their brain develops and processes that incoming stimuli. So some of you have probably seen this. This is, of course, from Elisa. She posted this on her Facebook page, I don't know, a few years ago. I think that's JJ in there. And I saw this, and I lost it. I was like, oh my God, that is the most awesome thing ever, because it's totally controlled by the puppies. So if you go out in this yard and you grab a hold of one of these strands and you start yanking it, that's not what we want, because that's you doing it to the puppy. What's great about this is that lots of different colors, sight, sound, tactile, textures, and the puppy controls it. He can decide whether he pokes it, grabs it. He can decide which string he pulls on for how long. The other puppies in the litter, if they hear those cans and they're like, I don't like that, they can go, well, I'm just going to go over here and I'm going to look at you from over here and see if you die. And then if you don't, I might go try it. So he gets to control it, and that is some of the power, that is the power of good socialization.
Can I ask you a question?
Yes.
So let's say that all the puppies are doing that and just one is staying back and it stays back. Do you do anything to try to encourage, or do you just let it go and let them figure it out?
So it's a great question. She said, let's say you have a litter of puppies and one of the puppies is kind of hanging back. And that's the one people always go pick out from the shelter. You know, they're like, oh, I felt so sorry for him. And I'm like, yeah, well, you're paying for that now, aren't you? I'm just kidding. But, so we help them by, what I do with puppies that come in that are like that, or these dogs that come out of hoarder situations and stuff, is we reinforce effort, but I don't try to coax them. Do not ever use food or toys or your charming personality to try to lure a puppy into a situation that makes it nervous. Like, oh, here's this big scary thing. Come on, and make a little treat trail up to it. Because what you're going to do is you're going to put the dog in an approach avoidance conflict. I want the food. That looks scary, but I'm a puppy and I love to eat. And if I don't eat, I could die, so I really should eat. And then they're just nervously approaching, and then they skitter away. And then the other thing that happens is that many of those dogs will develop a classically conditioned association that food predicts scary things. And once that happens, you have totally derailed your training and behavior mod program. Even for routine things like going into an obedience ring, if your dog has learned that food is not safe and sometimes has been paired with scary stuff, and you will mess your training up so bad. So if I have a puppy like that, I would have food treats, and if the puppy goes, I would drop the treats right there, and I'd be like, oh, that was awesome. Look how brave you were. And then he eats them, and then he might be like, yes, good. And then he runs away, and you're like, that's okay. And you might go, oh, good. So you reinforce their voluntary effort, but you don't try to coax them up to it. Whatever they can offer, yeah, that's great. And if you need to run away again, fine. But if I keep reinforcing you for coming back, and I make sure nothing bad happens, got to make sure nothing bad happens, because if the dog screws up its courage and then gets up to another dog or some weird piece of equipment like the Roomba kicks on right when they get there, then you're, back at square one or worse, okay? So surfaces, put stuff out, boxes, enclosed spaces so they feel it around their body. Like I said, grooming equipment. I got pictures in here, like they have artificial grass. These are people that breed search and rescue dogs. They have a great success rate with their rescue dogs because they have an awesome socialization program that starts with the puppies being born. Like they just have all this stuff they rotate. There's wood chips, there's artificial grass, there's fleece, stuffed animals, these little hard golf balls. Like these puppies get an exposure to all different types of tactile things, which of course all carry a different olfactory signature as well. So you get a double whammy there. And then once their eyes open, you've got all these different colors. So it doesn't have to be super laborious. You just have to do it. But you get a lot. Bring people over. Like, you got to be clean, but if you don't handle the puppies or you don't let the puppies approach people, like this puppy isn't mobile yet, so you can handle this puppy gently as long as you don't take it away from the mother very long. But then when they become mobile, that's when you sit down. This is socialization. You sit down, you let the puppies come to you, and if you pet them and they move away, you let them go. If you try to hold them and they start panicking and then they get away, you're just teaching them to panic and struggle and get away, which doesn't mean that you should hold them until they stop struggling. Please don't do that. That is not accepted puppy training technique. That's like dark ages dog training. But they need to be able to approach and leave and interact on the level that makes them comfortable. Can you feed them when they come do this? Absolutely. Absolutely, you can reinforce them for offering it. Make it a good experience, okay? Rotate your objects in your yard or your pen so that they're getting, again, you've got a short window, so you want to take advantage of the time that you have. If you leave the same stimuli in there for 12 weeks or however long you keep the puppies, you don't get that wide range of experiences that we want. Years ago, I got a dog that had access in the puppy environment to climbing surfaces, but not really to any of these other stimuli. Very barren in terms of exposure to people, sounds, odors, and as she grew up, she was extremely reactive to dogs, people, odors, sounds, and was great climbing on stuff. But when your dog walks into an empty hallway, when she's like 14 months of age and goes, and starts growling into the empty air, there's a problem. Like any new odor, she was like, oh, that's danger. So lots of variety. As they get mobile, get them out, increase exploratory opportunities, take them places, but there's still a lot of stuff that you can do in your own property so that when they go out someday and they step on a manhole cover or something that wobbles, they go, I'm used to this. I know what this does. But take them out, too. There are places you can go where you can take them as a litter and minimize risk. Frankly, your best protection against infection is good perinatal health. So I put on here secure base effect because just like people, how many of you have kids? So just like people, when kids are little and they venture out into the world, they use their parents as a secure base effect. Like they screw up their courage, they run out and they play with a new kid, and then they get a little nervous and they run back. So mom is a secure base effect. It is a healthy attachment that allows the individual to venture out and do a little risk taking. Puppies do that too. They do it with each other, but they do it with their mother. But you can also do it with something familiar like a crate or your car, where you go out and you are there and they can hide and then they go, oh, look how brave Johnny's going to be. I'm going to run after him. And then, oh my God, I heard a noise and I'm going to run back to her. Well, I didn't die. Maybe that's okay. He looks like he's having fun. And then they go out and do it again. That's normal. Like, it doesn't mean your puppy's screwed up. It's normal, unless the puppy never goes anywhere. Like never leaves. That one that sits off and then never does anything. So, as I said, take the litter or a group, go on car rides that don't end up at the vet, or the groomer, or some other scary place. And, anything you can do, individuals, odors. I mean, my dog's 11 now, the dog I have now, and going to Tractor Supply and stuff is like, she's still like, oh my God, it's like Disneyland. Even going to the hardware store because she's like, but none of that scares her because she's really well olfactory socialized. The previous dog I had still enjoyed sniffing things, but then occasionally, like the first time she smelled a ferret, the first time she smelled an African spur tortoise, she wigged because she was like, her brain just couldn't handle that. So, people and dogs, even if your dog's going to be a show dog, they just can't avoid being around people and dogs. Even the ones, owners are like, well, if I could just find that ranch. I have a friend that he has a ranch, and, I think if my dog could just go live there, he would be fine because he hates people. And I'm like, there are people on ranches. And there are usually other animals on ranches too. So like there's nowhere they can go where they're not going to see people and dogs Like, they have to get socialized to people and dogs. And as I mentioned, it can't just be Dobermans, or if you breed Frenchies or Whippets or German Shepherds or whatever. They need to see other, I mean, like, that doesn't even look like a dog. So, again, controlled exposures, especially to people and animals, because people and animals are sometimes unpredictable, you know. For all of you that may have had a nervous or reactive dog sometime, you know, and they come in your house and you tell people, or you're out in public and you're like, no, don't pet him, he's kind of nervous. And they're like, no, dogs love me. And then they go at him anyway, you know, like, those people are the bane of our existence. So you have to be aggressive about your control. You're out on a walk, you see two little kids running for your puppy, and your puppy's going, woo! And then they're like, no, stop. If they don't stop, like, you got to be aggressive. Stop, pick the puppy up, leave. Like, don't let bad stuff happen, because, again, at this age, it's not sometimes just an oopsie and, oh, he'll be fine. I had a lady that she got a silken windhound. She did all this research, great breeder, like, great. I mean, she did everything a dog owner should do. And the second time her puppy went on a walk, 3 weeks after she got him, second time he went on a walk around the neighborhood, he got attacked by 3 dogs. Oh. And he wasn't physically seriously injured, but he was psychologically devastated, like screaming. And then any dog-related stimuli, odor, sight, sound, anywhere he was, total panic. Like, it wrecked him. The only thing that saved that dog was, well, me, but no, I'm just kidding. She got him help right away. Like, she didn't wait and try to screw around with it for 6 months. She was in my office within 2 weeks, and we fixed that dog. Like, we did basically PTSD treatment on that dog, and he goes to Fast Cat and stuff, like, but if she hadn't gotten help, that dog would have been ruined for life from that one traumatic experience. So use lots of food, but as I said, do it carefully. Don't do it to bribe or lure the dog into an uncomfortable situation. Keep it short. You know, puppies live hard and then sleep hard, so taking them to, you know, an hour outing or a 2-hour festival, no, is way too much. When they go out, and I tell my owners this, when you take your puppy out or your adult dog out for a behavior mod session, that is your function. You don't go to a friend's house to visit and, oh, by the way, I'm going to take my dog and do some training while I'm there. No. You take your dog out to do training, or you take your puppy out to do a socialization visit, and that is your priority. Because if they don't, then what happens is people are like, oh, I really wanted to attend this picnic, and my puppy's kind of upset, but he'll be okay, and then they have their priorities wrong, and then the puppy has a bad experience, he gets overwhelmed, and now he's going to have a persisting behavior problem. So as soon as it looks like it might be going south, you're like, we're done. End of session, recoup, figure out how I'm going to fix it. Again, control the environment. It's got to be their choice, you know, because that makes or breaks you. We kind of talked about this. I'm just going to show you this little video because this, you know, our profession has to own this. It's probably a little bit older video, but still, this still happens. And this puppy's probably 6, 7, 8 weeks. If she's 6 weeks, she might recover. If she's 7 or 8 weeks, this is going to be one of those puppies that's either going to grow up to be terrified at the vet or grow up to eat us every time it comes in. You know? All right. So I mentioned this before. Epigenetic cellular and molecular mechanisms cause changes in gene expression. So not the genes that are there, but which ones are turned on and off. You can't roll back the clock after a stressful experience. So we want to prevent this from happening so that individuals are resilient and have ability to recover, because we can't reverse it. And that is why it's so important to prevent this from happening to begin with, bad experiences, and also absence of essential experiences, like maybe you never had a bad experience with a person, you just never met any, you know. Like, we can't go back and change it. And again, if you're breeding dogs, that dog is going to pass some of that on, even though it may not be in the genetics, okay? So when you start doing this kind of research, I'll tell you, when I started looking in and coming across this kind of research, this scared the tar out of me. I'm like, how do any of us ever even, like, we're doomed. Like, humans are doomed, dogs are, like, how do you fix this? I mean, you don't fix it. That doesn't mean we can't deal with it and we can't make it better. And the more knowledge we have, the more we know this can happen, then we can take better steps to ensure that it's less likely to happen, so that we get better dogs. So, keeping back to, so different age range, but same kind of thing about neural structure. A lot of research in people and other animals about early pain, sensitizing pain pathways forever. So, you know, even in humans, there are discussions about, you know, NICU patients that have to get venipuncture all the time, circumcision, things like that. Like, what are the effects that this is going to have? So we again need to kind of keep in mind, we're always kind of like, oh, we, you know, dock their tails and their dew claws when they're 2 days old or whatever, and they cry and then they fall asleep, so it must not be a bad thing. Well, it probably still is. Even just because they recover, every experience you have creates a different synaptic connection in your brain. Every single experience is building synaptic connections, and there are other ones weakening. They don't disappear, they weaken when they're not used. So this may be changing your animal's stress response system and their pain pathways. So again, we just maybe need to think about how we're doing it, and if I were doing these again, because I'm not in general practice anymore, I would be using pain control of some sort on these puppies.
Okay, what kind?
Could be local. There's a lot of good local options. And then there are other things like some of the short-acting opioids. There are alpha-2 agonists. Now, they wouldn't want to use those in puppies that young. But even if you're using locals for a while, you know, like long-acting locals, you're still not getting that intense pain experience at the time of the amputation. So, something to discuss with your vet.
What about banding?
I'm sorry?
Banding.
Banding? I wouldn't do, like, banding's like a long, uncomfortable process. You know, it's basically, and I'm sorry, I didn't come in at the beginning of the lecture for the last veterinarian who was here, so I don't remember her name. What's her last name? Vance. She even mentioned, you know, like basically like putting a rubber band around your finger and you cut the blood supply off, and as that tissue dies, it is intensely painful. Eventually it goes numb, but during the time that it's dying, if there's any inflammatory mediators still leaking through and it's still painful, like that would not be a process that I would recommend. So prepare them for specific situations like vet handling, noises, storms. We don't know for sure if doing basically noise vaccination will actually reduce the incidence of noise phobia in dogs because we're not 100% sure why so many dogs get noise phobia. Some of them it's obvious, like the house gets struck by lightning. But most of the dogs, it's kind of an insidious onset. There's probably genetic issues involved because some breeds, like border collies, are super noise hypersensitive, but we don't know entirely. However, doing good noise counter conditioning with puppies, like exposing them to CDs of fireworks and thunder and stuff, is not going to make them noise phobic unless you like totally mess it up. So it's one of those things, if you do it right, it may help, shouldn't hurt.
An app related to age that has a noise.
I'm sorry?
There's a puppy app
Uh-huh.
that does noises according to their ages. Have you seen that?
I have heard of it, but I'm not, I don't know details about it. But yeah, different kinds of apps, or even, like you said, looking at those contraptions that Elisa had. There are things that you can put in the environment that you can pair with good experiences. You can start them at a low level until it's like the train on the train track. When you move into a neighborhood near one, you're like, man, it just annoys me to begin with. But then when nothing bad happens, then it's just part of the background. Your brain filters it out, and that's what we want. We want them to be like, this is an inconsequential noise, so my brain's just going to filter it out, and I'm going to go to sleep even though Hurricane Ike came through, or whatever. All right.
I was going to say that about 3 weeks we introduced the Dremel because it's noise, plus we just tap.
Yeah, and she said she introduces the Dremel at 3 weeks. And you could, around 2.5 or 3 weeks, start introducing your Dremel by turning the Dremel on and setting it on the counter right before you feed the puppies. And I would do that for several meals. And then I would turn the Dremel on and I would set it on the ground and I would put the puppy pans down so that your Dremel becomes your Pavlovian bell. They go, Dremel, oh my God, we're going to get fed. Awesome. So by the time you actually, right, it's simple Pavlovian conditioning. By the time you actually, start working closer to the puppies, they already have this classically conditioned emotional response, like, yes, Dremel! And that's half the battle. That's actually 3/4 of the battle, is getting the emotional connection to what you want in the right way, instead of like, oh my God, it's a Dremel, ah! So, it's simple and easy to do. Turn it on, drop it, feed. But you have to put the Dremel on before you put the feed down. You can't do it the other way. You can't put the food down and then set the Dremel down. It doesn't work as well. So, working on show dogs is pretty nice because they've been taught to stand still, which is awesome. But, not everybody does that. But you can start, this puppy's 10 weeks old, and we just start really simple handling stuff. We do a lot of labeling now. The more information we can give the dogs, the better. So we actually will say eye, and then we mess with their eye. Or we say ear, and then we touch their ear so that they know what's coming, because trying to surprise them or trick them, never a good idea unless it's an emergency. So I want them to know, I'm going to pick your foot up. I'm going to tweak your toenail. We tell them before we poke them with needles. Like my dog gets Adequan injections. I show her the syringe. She gets food, and I touch her, and I go, poke, right before I stab her. I do not want her to be surprised, because surprise learning is really entrenched. Meaning they didn't know it was coming, and then, oh my God, and now you never get near them again with the syringe.
I had one that needed allergy shots. He heard me peel open the syringe and came running.
Good. You did a good job with your Pavlovian conditioning then. What were you feeding him?
Just his canned dog food.
Okay, well, awesome. Yeah. No, that's the kind of thing we want. So you can start this early, and this just becomes a game, which is I'm going to touch some part of your body, and then something great's going to happen. But notice, she's on the floor. She's not on a leash. if she leaves, she leaves. We never try to hold them back, because then you take the control away, then they start getting a little nervous, and now you're not going to get the Pavlovian conditioning that you want. Now you're starting to get it going the opposite direction, which is not what we want. So we mentioned about the noise CDs. Play the noises during feeding time. Just start them low at a level that's not going to scare them, and then you can gradually increase the intensity or the proximity to the actual bowls. Like you could get to where you had the Dremel right next to the puppy's bowls, even maybe vibrating against the edge of the bowl, but you just have to do it in little increments.
So, we're in northwest Wisconsin, so hearing gunshots is not unusual. But we were home over the 4th of July this year for the first time in 10 years, and our neighbors had a fireworks display that was louder and bigger than most state fairs. And we have no control over that.
Right.
So, how we minimize that impact without leaving him for the weekend.
Yeah, you know, this is the tough thing about noises. He said, you know, they had this big fireworks display that they don't have control over. The dogs are used to hearing gunshots, which are a little bit different than fireworks. And so if you know it's going to happen, like you know they're going to put this show on, then I do whatever management I can do to mitigate, meaning play background noise, go put them all in a room with like a massive, you know, amount of stuffed Kongs, so that you're drowning out the sound, you're giving them a lot of fun stuff to do, play games with them. And, you know, this is an advantage I have, but I still recommend it to people, is if you know something like that's going to happen, the next dog I get, I tell you, I will be doing this training, but for real initial bad storms and fireworks, I am going to preemptively medicate my dog until I know the training has set the dog up to be able to handle a full force episode. Because once they get that one terror episode and they're like, oh my God, the fireworks, I'm gonna die, it's really hard to get them back out of that because you can't control it very well. So talk to your vet and be like, is there a supplement or something I can just give? I'm going to work on this, but I didn't know this was going to happen. They're not prepared. I want to prevent this from turning into a bad experience that they can't recover from. All right, some of you are probably already aware of puppy culture. UltimatePuppy.com is only, I think, a website now. They used to have some great materials you could give to owners, but they don't have the little kits. Operation Socialization, those are just some good references that you can look at in puppy stuff. Oh, sorry.
Question for you about the Dremel. I've got a dog that's like, oh God, he's great in everything, he's raised in puppy culture, but somehow that Dremel, now he's like, oh God, and he stresses. How can I reverse that? What can I do to make it a little bit better?
So when you're taking a dog that already has a bad association with something, you know, the most effective thing is some process that we call like desensitization or counterconditioning. So to be successful, what you have to be able to do is re-expose the dog in very tiny increments. Like go back to just putting the Dremel on the floor, shut off, while you train or play or feed, until he just gets to where he's totally unconcerned about just the sight of the Dremel. And then you have to turn it on, but really low and far enough away from him that he goes, okay, well, I notice it's there, but I'm not worried about it. And then you do a lot of positive experiences to where he's either totally unconcerned or he's even like, oh, look, she got the Dremel out. We must be about to do something really fun, because usually she plays tug with me or whatever, or I get a can of canned food. And then you bring it, you know, closer. In the meantime, you're working on training the dog to let you handle his feet, same way, like, oh my God, Look, take my paw, darn it, take my paw so that you'll give me more chicken. That's what we're looking for, literally. They're like, here, please, take my foot. And then you build those together, you know, little by little. Now the problem becomes, especially if you have a Doberman, over the time it takes to do this, your dog's toenails are probably going to be this long. So what I tell my clients to do in the meantime, we sedate them. Like, we go in, we knock the dog out. I mean, out. Like, I want the dog to wake up and be like, what happened? Wow, they look awesome. Because if you wrestle the toenail trim, you're like, oh my God, I just got to get it done, even though he's not through the training. All that stuff you did up to that point, you've wrecked it. You've wrecked it. So we have to have a stopgap to buy you time to get the training done at the dog's pace.
And it's real important when you send them to their next home to go over that with the new owners,
Yeah.
because that can ruin everything too.
Yeah.
We dealt with that with
I'm sorry?
We dealt with that with my rescue girl, and my trainer also taught us something else around the concept of.
Can you speak up just a little bit? Sorry.
I said we have two. Our older one is a rescue girl, and she struggled with the concept of the nails too. And so our trainer really helped us on even things like tapping, getting the dog to be able to be okay with
Yes.
tapping of a nail with a pen.
Yes, tiny little approximations.
Yeah.
You know, can I hold it? Everything, you know, like you have to be able to isolate a toe. They have to be comfortable with you bending it to kind of poke the nail out, the site with the Dremel or whatever coming near it without it being turned on, the tapping, the squeezing if you're using clippers, because clippers squeeze before they cut, which I actually think is half the problem dogs have with, aside from cutting the quick, is the squeezing effect. Like, the more you break the process down into those tiny little increments, the more successful you're going to be.
She also taught us the concept of consent training.
Yes,
That made all the difference in the world. So back to that concept of having a choice.
they need choice, and they have to be able to control it. Yep. All right, as I mentioned, no one has studied adolescence in dogs, or really any of our other domestic stuff specifically. So we're going to talk about puberty and adolescence because they're not the same thing, but they do overlap a little bit, and there are different neurobiologic and neurophysiologic effects of those. So you don't have to really worry about that kind of scary little diagram, but not all adolescent changes are related to puberty. That's one thing to be important about. Like, even if you didn't have any gonads, there are still adolescent changes happening in your brain that are independent of the influence of sex steroids, okay? And again, puberty and adolescence are not the same. Puberty happens before adolescence in most of our stuff. So puberty is when you become sexually active. So your brain, when you're in utero, is organized, boy or girl, based on sex steroids that happen when you're in utero, all right? So are you getting an influence of testosterone or estrogen, and then you're born a boy or a girl, or sometimes they come out both because the messages get messed up and then you have a hermaphrodite or something, okay? And then you are hormonally quiescent for the most part until puberty, and that's when we get what we call these activational effects of sex steroids, of testosterone and estrogen. That's when everything kicks in, and, you know, kids, their voices change and they grow hair, and, you know, you start developing up front, and dogs start humping everything, and the male dogs stop eating, and then they want to sniff and pee on everything because that's all they care about. They're just like horny little teenagers. So what we used to think that pubertal hormones had only activational effects, and that all the brain organization was already accomplished in utero. But now there's research to say that's not the case, And now some of those pubertal hormones are actually creating alterations in different brain structures and how they develop, and there are differences in some of those brain structures between like females and males. Like there's differences in the size of your amygdala and stuff between boys and girls, or at least male and female rats, right? So puberty is triggered by the brain. Oops, let me go back there. Oh, I went the wrong way, sorry. Puberty is triggered by the brain, and that's what triggers your gonads to say, okay, now we need to pump all this testosterone or whatever out, or the bitch is gonna go in heat, all right? That is controlled by the brain. It's just we see the effects once the sex steroids actually are released, okay? So puberty is impacted by internal factors, external stimuli. Like a big issue in people nowadays are these bisphenols that are in plastic water bottles because they mimic sex steroids, and they are actually creating early puberty in girls. Like girls used to go through puberty at like 13 or 14, and now some of them do it at 10 or 11. And that is related to environmental pollutants and contaminants in part, and probably also diet. So it probably is having, why couldn't it have a similar impact on our dogs? Because our dogs drink water that comes out of plastic bottles, and our dogs drink water and engage in environmental interactions from the bajillion insecticides that get pumped everywhere, and the stuff that goes into the ingredients that go into our food and whatnot. So there's probably some similar effects as well. So as I said, these are organizational and activational. Activational effects are transient, and they have this surge like in testosterone, and then it goes away until, well, in males it doesn't actually come back, but unless you're one of the seasonal species like cats and horses and sheep. So there are, as I mentioned, some dimorphic changes in the brain. So if you look in rats, for example, the LC is the part of the brain that is involved in the release of norepinephrine. And norepinephrine and that part of the brain are involved in attention, memory, and anxiety and vigilance. So when we see individuals that have excessive LC activity, they have too much norepinephrine, they're usually like hyperactive disorders, and just generalized anxiety, difficulty focusing, and fight-flight kind of system, all right? So I mentioned about early puberty in people, because this is where the research is. Early puberty increases the risk of psychopathology in people, like depression and eating disorders. So I don't know if this is having an impact in dogs. We do see some disorders in dogs or changes in behavior, pathologic changes in behavior that sometimes happen during adolescence. So in humans during adolescence, this is when we see onset like bipolar disorder, schizophrenia, generally happens during their teenage and early adulthood. We see dogs sometimes that come in, they're a little rare. The particular example I'm going to give you is a little rare, but it's out there. They come out of a good breeder. They've been well socialized, not over socialized, but literally they're behaving like normal, well socialized puppies. And then sometime between usually 8 to 14 months of age, I'm not joking, they do a total 180. And there's like, I don't know what happened. The dog's terrified of everything, won't leave the house. Completely different dog. I've seen these, like completely different dog. That is a brain development change and a psychopathology in a dog. And it is related, we're going to talk more when we get to the adolescent part, about changes in brain development and your synaptic connections. And I'm sure that is what is happening to those dogs because they have not had traumatic experiences that triggered it. There's not been any, castration or anything. They just are not the same dog, and it's related to brain development. Fortunately, they're uncommon, but we see milder effects of those changes in a lot of other dogs. So adolescence transition from childhood to adulthood, puberty is part of that, but a smaller section. And this involves changes in emotional, social, and cognitive effects on the individual, all right? So this is teenage years in people, basically 10-ish, 12, up to 20. In people, we consider your brain mature around 25, so mid to late 20s. In dogs, we say it's probably about 3, because that's when they seem to not be quite so stupid about some things. But we base that on what we see clinically or anecdotally about their behavior. They just seem to level out around 3 in whatever behavior pattern they're already in. So that doesn't mean when dogs get to be, if they've had a behavior problem through their adolescence, that when they get 3, they're magically going to get better. They just level out in whatever they are. So if they're a stranger danger dog, or they're aggressive to other dogs, and you might have this kind of up and down, 2 steps forward, 1 step back kind of thing, when they get to 3, they're just going to level out of their dog aggression, but it's not necessarily going to get better on its own. So this is what behavioral traits of adolescents are. They have increased novelty seeking, increased risk taking, and this is again related to brain development that we're going to talk about. They have increased emotional reactivity. How many of you in here have or had teenagers at some point? Yeah, so you know all what I'm talking about. They have an impulsivity that is not genetic. So it's a phase of impulsivity, not necessarily an inherent impulse control disorder. So impulsivity during adolescence is not the same as, for example, having ADHD. ADHD is an inherent pathology of behavior, and it isn't specific to a phase of the life. They have increased social affiliation and peer-related interactions, and they're different than when they're puppies, because 6-year-old kids don't treat each other the same way 16-year-old kids do. There are different things that are important, and peer competition becomes escalated when you get into your teenage years, and that's a biologically evolutionary phase. So we see the same thing in our dogs. People come to me all the time, and he's like, oh, he's always been so great with dogs, and he played with dogs all the time, and now he's like, he attacks them. And I'm like, well, when did this start? Well, he was probably about a year old. Well, that's because he's not 6 anymore. Now he's the equivalent of like a 13-year-old kid, and his peer relations are changing. So just because a dog's friendly when they're 6 or 8 months of age to other dogs doesn't mean they're still going to be friendly at 2.5. So why do we have these behavioral changes? Because it encourages them to move out. They have to leave the natal unit, or else they never form their own family and reproduce, okay? It gives them enhanced threat detection so they don't get killed, because when you're with the mother, it's your parents' job to keep you from getting killed for a certain amount of your life, but at some point you go out on your own, and now you have to take that responsibility on your own. So that means when these dogs get to this age, and how many of you have had dogs that when they got again around 8 or 9 months of age, maybe up to 14 or so months of age, and then you're taking them out in public, and they've always been super friendly, and now they're out boofing at people, like. I've seen some of them walking in the halls in here, like they're bebopping along, and they see me, and they're like. And it's partly a phase of their development. The adults don't do that. The only ones I've seen do that here today are the ones that look like they're probably between like 4 and 6, 7 months of age. They're along and they're like, huh?
Is it your horizontal?
Yeah, they were just raised with vertical curtains. And it improves their likelihood of finding reproductive partners. Like, it's a biological function. So, given that every animal goes through this, cats, horses, rats, dogs, it is reasonable to imply that similar neurobiologic changes are happening in dogs and cats and horses, because clinically we see similar behavior. Like, I mean, my dog, the last couple I had, that they were like a year, and I'm like, oh my God, are you ever going to stop spazzing out and like leaping or mouthing or, freaking out about stupid stuff? And they do if you channel them the right way. But it's partly they can't help it, So again, those of you who had teenagers, if you're like, why did you do that? Something that wasn't all that brilliant. And then sometimes they're like, well, I don't really know. Because honestly, they don't. And I'll show you why. Somewhere in here. So this is why, right here. The white matter in your brain, this is your tracks of neurons. So you have neuron bodies in your brain, and those neurons have these big giant tails called axons that go to either other parts in your brain or down your neck to your leg and your kidneys. Like some of your axons are like 3 feet long in a person, because they have to go from your brain all the way down to your foot. So those white matter tracks, they transmit information. This is what we call white matter. That develops linearly, right like that, across the age. I think I have a chart in here. Let me see if I put the chart in here. Here's the chart. All right, here's the chart. This is basically your white matter kind of limbic region, your emotional part, all right? So the white matter, I'm going to go back here, increases linearly. The gray matter is the actual neurons and all their little synaptic connections. So remember I said everything you do, everything you learn, you're forming a new synaptic connection when you learn, every single time. When you're in adolescence, the brain explodes with synaptic connections. Like it makes way too many, way more than it needs, just like they're developing everywhere. And then as they get into late teenage years, early adulthood, your brain's pruning out all those branches that it doesn't really need and that aren't actually being practiced. So there's this U where you start low, you get a bunch of synaptic connections, and then it tapers down, and eventually that line and this line, because this one's going like this is your white matter, and your gray matter is going like this, and then eventually they meet, and that's when you become sane, right there. 25, you can rent a car, okay? But when there's this dichotomy between executive function, gray matter, thinking, look before you leap, that's when they literally can't sometimes control what they're doing. So that's why you have all this risk-taking behavior, because the risk-taking trends with the gray matter, that big hump, and your white matter and your ability to do impulsivity is the white matter. That's the part of the brain we want them to think with. The prefrontal cortex, executive functioning, planning, assessing risk-taking, behavioral inhibition, like maybe I better think about this. This financial investment is too risky. I better not do it. All right? That's the part of the brain that we want them to do. It's the antithesis of your fight-flight. This is your fight-flight. So they go through this phase where they are really difficult, basically. So they're very hard to live with. There are also changes in neurochemicals. So dopamine's your reward neurotransmitter. It does a lot of other things, but it increases during adolescence and it peaks there, and that means they're very reward seeking. I've got to have those new Air Jordans. Like, I got to have this. I got to do this. Like, I need stuff right now. So it increases reward seeking, which contributes to the risk taking and the impulsivity, because if they get reward when they do an impulsive behavior, then they're going to do it again. Like, that's what reinforcement is. It's basically reinforcement for that behavior. So all of this just tells us that we have this, again, dichotomy between emotional regulation and impulse control and the part of your brain that makes good, logical, rational decisions. At some point, those two come together, but during adolescence, the risk-taking, emotional side has precedence over the other part. So that's why, despite good training, well, I could argue this is good training, that they do stuff like this when they're that age. And they have poor impulse control. Which doesn't mean you can't train them, of course, but there's just a difficulty there for a while. And this is the phase where I tell my clients, your dog's either going to be heading toward a gang or prison or college. That's the phase. And so what we do helps determine which route they end up on, because they still need help. I mean, you're still a parent even though they're, you know, a teenager. Okay? Elisa just tortures me with this dog all the time.
You want it, right?
I did. I was like, I want her. And she was like, no. And then she just posts pictures all the time. And I was like, stop it!
Is that Kima?
Yes.
Yeah, she's
So I have a silly question, maybe. I have a 9-month-old puppy who loves to swim. And, I mean, it's great. She's going to be a dock diver like her older brother. But we recently put the Aquabot, which is a mechanical vacuum, into the pool while she was running around the outside of the pool. So we were done. We were closed up for the night or whatever. And it climbs the walls. And it climbed the wall, and when it climbed the wall, it makes all kinds of splashes.
Yeah.
She went ballistic on it. She went over, she was barking at it like she wanted to kill it.
Yep.
Do we just ignore it?
No.
What do I do?
No, she said the dog went berserk over her pool vacuum, basically, the first time she saw it in the pool coming up splashing. And that and she's like, do you ignore it? And I was like, no, because you remember all that dopamine? Like, your dog just got a massive cocaine-sized dopamine dump. And now you have to manage that tightly. Like, dog's not out with the the pool vacuum.
It's an Aquabot, but I know what you're
Yeah, Aquabot on, and it's almost like the Dremel thing now, which is that you work on it actively. You say, okay, I'm going to put the dog on a leash. I'm getting some behaviors she knows, some really high-value reinforcers. I'm going to move her to the other side of the pool. I'm going to have the Aquabot in there, somebody controlling it, so it doesn't just go berserk and climb walls, but maybe we turn it on for like 30 seconds. I teach the dog an incompatible low arousal behavior, shut it off, like lay down on a mat, sit and look at you, but it has to, again, be voluntary, like not the I'm looking and correcting the dog for looking. Like, the dog has to hold herself, because if she doesn't learn to on her own, if it's kind of a forced stay, you're still going to have the physiologic arousal related to the aquabot, even though she may not be chasing it. But her brain, her mental, thoughts, if you will, are probably still going, aquabot, I can't move, aquabot, aquabot, and then you're just going to be fighting the behavior. So I want to get the dog to the point where she goes, aquabot, oh, this is so much more fun than that. Oh, it splashed. Oh, but this is more fun. Okay, I can relax. And then you move her closer and you let it run longer. So don't let her practice it, because when she practices it, she's going to get reinforced for that spaz every time, and you are going to ingrain that behavior.
I'm just doing stuff to have her mind on something else. I'm not necessarily.
I want her to know it's there. She has to know it's there, but then she has to be, the training session has to be set up so that she can actually make the choice on her own to go, yes, I can sit. I know how to sit. I love sitting. I can sit instead of doing that. And then you're going to reinforce it. Maybe you play tug. Look at the aquabot. Okay, I can look at you. Great. Going to reinforce you by playing tug or throwing a Kong or feeding you or whatever. But I want her to be able to do that choice. You can help her, like whatever her name is. If she looks over there, you might just Fido. But if she doesn't look back, I don't go, Fido, stop, look over here.
Okay.
Because then you're just adding arousal into the situation.
It's not like she's going to see that all the time, but it's just that she just went ballistic on it.
Yeah.
Like, if she could have gotten it, she does with the vacuum cleaner too, when she tries to chew on this stuff. I have to put her outside when I vacuum the house, otherwise she destroys it. But anyway, she just is ballistic over that. Okay, so I got it. All right, thank you.
Same-sex dog aggression is, there's a propensity of it with Doberman Pinscher. In your opinion, is any of that preventable or through socialization techniques?
Yes, she said, is dog aggression preventable? And it is malleable, one, by better breeding practices, because there is a heritable component, and two, by effective socialization. So the dogs, so I tended over the years to have a lot of my Dobermans from a particular breeder. I never had dog aggression problems with them, even though she told me it was in her line. It wasn't, because none of the dogs we had dog aggression problems, and so there was a very strong nurture component to the dog aggression in her line that, so good socialization, good training practices, good management, not letting them have bad experiences or practice even that kind of stuff towards each other, so that we're always reinforcing appropriate social behavior, not letting dogs learn to greet each other in an aroused state on tight leashes, like if you have to hold your dog back, even though it's happy, what it's learning is to greet dogs in a hyper-aroused state. And dogs don't normally greet that way. If you watch village dogs and these dogs that, run loose in St. Kitts and other countries, they don't run up to each other going, they don't. They may run up and they slow down, and they do their little posturing and sniffing. And then maybe they scuffle, but most of the time they don't. And then they, somebody walks off and pees on a tree, and then they just go about their way, But we let them greet in hyper-aroused states because most of our dogs are hyper-aroused on leash, and we greet them on leash, and then the dogs learn to greet that way, and it actually triggers a lot of fighting. So yes, there is a very strong socialization and training component to it.
I was going to ask you on different breed behavior. Do you find that, like, you've had Dobermans, so do you find that Dobermans learn a lot by just watching another Doberman do things? Because
she said, do Dobermans learn a lot by watching other Dobermans do things? So I'm going to answer it in my personal experience and then what we know about dogs.
Okay.
So I have never particularly had my dogs learn much from each other, and it may partly, not anything really important. I mean, they do socially facilitate, you know, like, oh, somebody barked at the front window, and then the other dog runs and barks at the window. It's like, what are we barking at? Oh, we're barking at that, okay. The data tells us that dogs are not great at learning from each other aside from social facilitation. So social facilitation is one dog doing something and it encourages the other dog to join and end up doing the same thing. True observational learning would be like if I'm a dog and then I see you go pick a blue ball out from a pile of other balls of different colors and bring it back and drop it in a bucket. And then they take you away, and then somebody tells me to go do the same thing. That's true observational learning. And there's not a lot of data in dogs that it happens except maybe some mother to puppy stuff. There's some there. It's just not super, super strong. But social facilitation's strong. If you went to get the blue ball and I went with you, I'd be like, oh, we're getting the blue ball? Oh, okay. That does happen.
We've just seen it in sports, like fast cats, of course, they just watch the dogs and then they just go do it. They've never been introduced before. But
Yeah, but that's also a different,
innate drive.
yeah. I think there's, an arousal like, oh my God, he's chasing something. And it's an easy behavior to facilitate, you know. But somebody back there had one.
Yeah, you had mentioned one of the time periods is 14 to 18 months. And you've got all
Probably.
but you've got all this adolescence neurobiology stuff going on too. As training during that time, are you going back to more of your foundation behaviors that you worked with when they were younger? I mean, how do you help them get through that period where we're kind of doing it in the neonatal phase where we can prep for them at that stuff?
Yeah.
But now they're much older, and so how do you deal with some of those?
Yeah, it's a good question. She said, you know, when they go through that adolescent period, which may encompass another fear-ish period, do you go back to training basics? Not necessarily. Really what you just do is you have to look at the dog and say, what is the dog capable of today or at this phase of its training? And if for, I don't know, let's say you're working on obedience competition, like show ring prep, and the dog will be like, psh, training class, got it, ready to learn new lessons, move on. But maybe then you take your dog out, you know, just an outing for Tractor Supply, which you've done many times before, and you start noticing during that phase that the dog's kind of a little chuffy or boofy or looking at people longer and not going up and saying hi like it was before. That you need to adjust your training for the dog saying, I am now struggling with this. And we have to back up, make it easier, more positive experiences. Don't let people come up and pet me without asking, you know, like, so it's all, no matter what the age or problem, it's all about looking at your learner and saying, what is my learner saying that he or she can or cannot handle or accomplish today or right now, and adapting. Any other questions? All right, thank you for your time.
Thank you.